OPRA exam is a really important step if you're planning to work as a pharmacist in Australia or New Zealand. The syllabus of the OPRA exam is vast, but don't worry. It's all about making sure you're confident in both the science and the practical side of pharmacy. Here is Elite Expertise's take on it, breaking down the syllabus for your understanding and covering a few tips and tricks. Before we start, here is a small note for you that if you want to know in detail about the OPRA exam syllabus, please visit the APC official website. Now let's jump into the syllabus. What's in the OPRA exam syllabus? The OPRA exam encompasses 5 content areas, and here is a blueprint of the syllabus. Biomedical Sciences, 20%. Medicinal Chemistry and Biopharmaceutics, 10%. Pharmacokinetics and Pharmacodynamics, 10%. Pharmacology and Toxicology, 15%. Therapeutics and Patient Care, 45%. 1. Biomedical Sciences. This is where you learn about how the body works and what happens when things go wrong. It's all the basics, like how the heart, lungs, and hormones work, and how diseases like diabetes or asthma mess with those systems. There's also a bit of microbiology, think bacteria, viruses, and immunology, like how vaccines protect us. Why it matters. These are the fundamentals you'll use to understand diseases and how medicines can help. 2. Medicinal Chemistry and Biopharmaceutics. Now we're diving into how medicines are designed and delivered. You'll study how drugs are absorbed, metabolized, and excreted by the body. That's what we call ADME. Plus, you'll learn why some medicines come in tablets while others are injections or inhalers. Why it matters. This helps you figure out how medicines actually work inside the body. 3. Pharmacokinetics and Pharmacodynamics. Here's where it gets a bit math-heavy but super practical. This part looks at how long a drug stays in the body, how quickly it gets to work, and what dose is safe. You'll also learn about things like drug interactions and adjustments for special groups like kids or older adults. Why it matters. Knowing this helps you calculate doses and avoid errors. 4. Pharmacology and Toxicology. This is all about how drugs affect the body, how they relieve pain, lower blood pressure, or help fight cancer. You'll also learn about side effects, overdoses, and how to manage them. Why it matters. It's the core of what you'll need when recommending treatments or handling emergencies. 5. Therapeutics and Patient Care. Finally, this part is where all the science meets the real world. You'll learn how to apply everything to treat actual patients. This includes figuring out doses, managing common conditions like migraines or infections, and even promoting healthy habits like quitting smoking. Why it matters. This is where you really become a problem solver for your patients. How is the exam structured? The OPRA exam isn't just about memorizing facts. It tests your ability to apply what you've learned. As mentioned on the APC website, here is a better understanding of it. 55% is recall, like definitions and key concepts. 30% is understanding, so you'll need to explain or categorize things. 15% is application, where you solve problems or work through scenarios. Pro tip: focus on recall first since it's the biggest chunk, but don't ignore practicing problem solving too. How to prepare for OPRA exam. Start with a plan. The syllabus is big, so split your study time across all the sections. Focus on high-yield topics. Pharmacology, therapeutics, and patient care are key areas. Practice questions. Go through as many sample questions as possible. It's the best way to get familiar with the exam style. Study in groups. It helps to bounce ideas off others, especially for tricky concepts. Mock exams. These are game changers. They help you manage time and build confidence. How Elite Expertise can help you. Now, preparing for something like OPRA exam can feel overwhelming, and that's where Elite Expertise comes in. We've designed a structured syllabus that simplifies everything for you. No guesswork, no stress. Our live sessions are led by accredited clinical pharmacists in Australia, Mr. Arif Mohammed and Mrs. Harika Bhimavarapu, who know exactly what's needed to pass this exam and excel in practice. We focus on breaking down tough topics so everything feels clear and manageable. Plus, we include mock tests and real-world scenarios to make sure you're exam ready. With our support, You're not just preparing for an exam, you're getting ready for an exciting pharmacy career in Australia or New Zealand.